comments and kind of frame, I think, the situation as it exists here in our state with respect to the data. Talk a little bit about the objectives that we need to focus on as we look towards the fall and the reopening of the schools. Probably the most important thing that we do in state government, and certainly among the more difficult decisions that we have. I'm joined today by members of our public health team, Dr. Rick Hong, who's the state medical director, you'll hear from in a minute, and Jamie Mack, who's the director of environmental health at the Division of Public Health, and has been doing a tremendous job working with business sectors, working with the nonprofit sector, working with special groups and gatherings like the State Fair, like Dover Downs, and any of the big events that you can think of in Delaware. Jamie Mack and his team have been working with them to try to do it in a way that's safe, protective of fans and participants, and really helpful in moving through as we've reopened our economy into phase two. As I think about back over the last 4 months, and you'll see it in the data that we're going to present and talk about in a minute and have for the last several weeks, Delawareans have really come together to do what we asked them to do kind of months ago, which was to flatten the curve. We experienced a significant peak in new positive cases back at the end of March and into April. Hit our peak in late April as we closed down business sectors and issued stay-at-home orders. And if you look at the experience across the country, most states experienced the same kind of a trend and the same kind of narrative, where they had a real difficult spike at the beginning, which threatened in many cases their hospital capacity to deal with the critical cases. Significant number of people who were sick and critically ill, and those who passed on, particularly in states in our region, in New Jersey and New York and some of the New England states. But then after that really serious peak, saw a pretty significant and pronounced improvement on the other side. And we all, as part of the conference calls with the White House Task Force each week, followed the guidance. We in the Northeast region followed the guidance of the Centers for Disease Control, when we're looking for really 14 days of improving conditions on a number of measures, including the ones that we use today and we'll talk about today, in terms of the increase in percent positives, or the decrease, the number of percent positives on a 5 and then 7 day moving average, the number of new cases, hospitalizations, and after that 14-day contemplated reopening our economy. As I've said time and again, that in order to have a healthy economy, you have to have a healthy community. In order to have a healthy community, you have to have a healthy economy. It can't be one or the other. It has to be both. And we've tried to strike that right balance between reopening in a safe way and protecting the spread of the virus. And we've seen a little bit of rebound, and you'll see that as we go through these data points, as we flatten the curve and hit a bottom. We never really did threaten the hospital capacity, particularly that to treat critically ill patients and the number of ventilators we would need to do that, like we're seeing in some of the states in the Southeast and Southwest today. And yet, some days or weeks after, the days after really, we started reopening in phase one and into phase two after Memorial Day and before the 4th of July. We had an uptick driven mostly by cases in the young adult demographic, in the bar and restaurant industries along in our beach communities, and took some actions to try to flatten that curve. And as we look at the data today, we're looking at a situation where the number of positive cases and the percent positive, and with significant testing we're doing in the beach communities, have flattened out. Again, not where we want to be, either there or across the state. And so as we sit here today, approaching the end of July and the beginning of August, and looking towards the reopening of school in a hybrid kind of fashion, which we'll also talk about today, we know that there are certain things that we have to do to get better. And I have every confidence the Delawareans will pull together for the benefit of our businesses, particularly our hospitality businesses, bars and restaurants that need to be opened in order to survive, the need to do it safely in order to protect the public from the spread of the virus. And so we can more safely move towards reopening the schools in a hybrid kind of way, a mix of remote and in-person instruction, and our districts are working really hard trying to address the concerns of parents and teachers and staff, really important concerns that each of the stakeholders have, and we all have a stake in that. And the stake that we have, or what we can do, is we can follow the guidance around wearing masks. It's clearly the most important thing that everybody can do to prevent the spread of the COVID-19 virus is wear a mask and wear it appropriately in public, covering the nose and the mouth. Now, all the evidence suggests that that's the most important thing that we can do. Avoid and be careful in larger gatherings, particularly if it's indoors, and those are consistent with our restrictions in terms of phase 2 as we look towards phase 3 and we look towards opening our schools. And so when you think about those two really important objectives, getting further along in reopening the economy and in reopening our schools in a meaningful way so children can get the best instruction, the instruction they need, particularly the elementary school students to learn how to read by grade 3 and other students to progress through middle school and high school and on into the economy or to higher education. We're going to be able to accomplish those goals and reopen businesses if we do a better job, lean into it a little bit more, everybody pull together, wear the face masks so that we flatten that curve even more and get to a place where we were just a month or so ago when we hit the bottom in terms of flattening the curve. Unlike other states that are now seeing their cases accelerated that never saw that improvement like we saw in Delaware and Pennsylvania, Maryland, New York, New Jersey, other states in our region, and into the New England states. We don't want to lose that ground that we gained over those years. So today we're going to talk about the criteria for reopening schools and doing it safely and doing it in a way that is responsive to the concerns of teachers and staff and parents. And we're not going to open schools. The districts in our state won't do it if they can't do it safely. We believe at least the conditions on the ground today are adequate to reopen schools in a mixed hybrid kind of fashion. As governor, I believe that we ought to lean into doing it for the elementary school kids, and we'll see some data with respect to infection rates there and just the need to have those children in front of teachers learning how to read and all their early activities a little bit easier to manage, recognizing that every school district is a little bit different. So let's pull together as Delawareans, enable our businesses to open more, enable our schools to open in more than just remote learning, and to protect the health and safety of all of us. And so I'm pleased to be here with Dr. Hong and Jamie Mack, two members of our team that have been doing a tremendous job over the last 4 months. So let's walk through the numbers. Here are the big numbers, almost 15,000 total positive cases. We've really ramped up testing, over 160,000 negative tests. The number of fatalities continues to flatten out and decline, but every one of these lives is precious, 580 total. And our hospitalizations, 13 new hospitalizations. We've ticked up a little bit, 62 current. I talked to the hospital folks yesterday on our conference call. It was barely noticeable in each of their facilities because as you spread, it's about 10 or more new hospitalizations over a week ago. It's hard to see in the 5 or 6 hospitals that we have, 14 critical, so the criticality is still pretty good. We're under the World Health Organization target of 4.1% positive. On the 7-day average, we want to be much better than that. We want to be down under 3%. We'll talk about that in a minute with respect to reopening our schools. This is a good place to be, but not where we want to be. And that's kind of the point in our situation now. We're in this middle ground between being really good and really bad, moderately good or moderately bad, depending on whether you're an optimist or a pessimist. I'm an optimist. We're at 94.6, almost 95 new cases per day. We want to be below that as we move into the reopening of schools. So in Newcastle County, we're up to almost 6,600 positive cases, 2,100 in Kent County, and 5,500 in Sussex County. Still Sussex County, the largest percentage of cases as part of their population, and although their rates are flattening a little bit. Two big outbreaks that we've seen, and we've met in Sussex County early on in the spring with poultry workers, and then as we opened bars and restaurants and the beaches in our beach communities there. And so we continue to focus testing there, to focus our efforts with respect to enforcement, and we'll talk a little bit about that, Jamie Mack. This comparison and graph, a little bit difficult to distinguish the colors, but I would just draw your attention to the two top lines. Those are the middle age categories, and you can see right there around the middle of June, middle to late June, that age cohort of 18 to 34-year-olds had a dramatic, noticeable increase, not dramatic, increase in the number of cases, and that was the outbreak that we saw within the beach communities, driven mostly by that demographic, so young adults from 18 to 34, and becoming this subgroup with the most cases. And so you can see as we started to flatten out, if we continued flattening out and didn't have that outbreak, we'd be in a much better position today. And then to think about our objectives with respect to education, obviously we have concern for teachers and staff that are in the more vulnerable demographics, but the children, both the two bottom lines are infants to age 5 and 5 to 17, and a very low percentage, a number of those in that age group. And so we think, again, given the conditions on the ground, that we can reopen the schools with a mix of remote and in-person learning. So let's look at the 14-day view. You can see current hospitalizations have ticked up a little bit, but still over the 14-day period of time on terms of new admissions, a little bit on a downward trend. Current hospitalizations, as we said earlier, are up above 60 now. We had bottomed out at about 47 a week or so ago. You'll remember back in April, the end of April, when we peaked, we were at 337. So we've improved considerably from then. It's both a function of improving health conditions and the spread, as well as the criticality of the illness, and that's associated with, in part, I think, with the younger demographic. The criteria that we're really doing well on is the percent positive. Again, 5%, we're under 5%. We need to be better than that still, and that's why we're going to lean into enforcement a little bit. Jamie Mack's going to talk about that, and that's where we want to be, under 3%, as we move into the reopening of the schools. Our new positive cases have jumped up and down. You can see that on the bottom far left graph. The orange line are the day-to-day number of cases, and the moving average is the blue bar. And so we're just right there at our cutoff period, just at about 100 cases per day, a little bit less than that when we have our measure for cases in our school criteria, a little bit different there, but same type of approach. We want to be lower there as the overall message. And then the two last graphs are just the emergency department visits. Again, a clear peak in March to April period, and then flattening out, a little bit of an incline there recently. If you look back over the 90-day view, it's consistent with the narrative that I've been mentioning. I would draw your attention in particular to the bottom far left graph there, which is a graph of new positive cases. I mean, you can see the late April, the early May, mid-May, a number of cases was at it just about after the peak, and then we flattened out pretty good where we wanted to be, where we want to be today. And then it correlates pretty directly with the reopening, and you can see the uptick in positive new cases, which, by the way, is the criteria that are keeping us on quarantine lists in New Jersey, New York, and Connecticut, now added to the quarantine lists in Washington, D.C. Communicated this morning with Governor Murphy. We continue to have conversations about that. Bottom line for us, though, is we can take our destiny in our own hands by flattening that curve more. And that's what we're suggesting that we do today for the benefit of our economy and for the benefit of our school children both. Again, this is the blown up rendition of that percent positive graph, and you can see the clear peak. It's a little bit more pronounced because we were doing fewer tests back in that March, April period where there was the peak, and then as we increased the denominator, meaning the number of tests, and the numerator went down in that fraction because of the decline in number of positive cases, you can see it flattening out. This is kind of the classic Dr. Hong, pandemic kind of a surge and then an improvement. We had this kind of an improvement, like the states around us, like the states in the Northeast region, unlike the states now that are getting a peak, if you will, where they never had that improvement. Unfortunately, we lost some of that ground that we paid dearly for, and particularly some businesses as they were closed during that period of time in the May to early June, as before we opened up in phase one. We want to get back to there without going back in terms of closing down these businesses. So we want to have our cake and eat it too. We want to be healthy and we want to be open. And that requires all of us to wear a mask. It's a small sacrifice for the good of all of us, and particularly the good of our businesses, mostly small businesses, restaurant, bars and hospitality and others, retail establishments, as well as the health conditions that will enable us to safely open our schools, which we believe that we can do in a modified kind of way. We are at the same time ramping up testing. Hard to distinguish among the states here, but the darker colored states are those that are testing more per 100,000. Delaware is among the leaders there. Washington, D.C. and Louisiana, it looks like, and Alaska are at the top, and many of us are bunched just below them. And so we're meeting our goals for testing, but I would use this opportunity to encourage people, whether you feel sick or not, to get tested. In fact, it can help us with our percent positive, because if you're not sick and you're getting tested, that's going to help that fraction there. It also gives us an idea of where we have asymptomatic spread, and we've learned that there's a lot of that out there, meaning people that do not have symptoms, flu-like symptoms, COVID-19-like symptoms, but are testing positive. And tend to be, I think, a little bit younger in that category, Dr. Hong. Don't want to get out of my lane here, but I've listened to a lot of your colleagues talk about that. But this is a place where we, as individuals, can lean in. We have, I think, a testing down in Laurel today, a little bit of a disappointing one a week or so ago. Really good turnout today, and that's the kind of thing we need across our state. Again, with respect to personal protective equipment, we've got a lot of questions about that, particularly from stakeholders involved with the school reopening, and we're still feeling pretty good about our inventories, our warehouse stockpiles, but we would encourage all of our private partners, nursing homes, hospitals, care businesses to build their stockpiles as well as we move into the fall. So let's talk a little bit about the criteria for opening the schools. You'll remember from last week that the working group of educators, public health officials, elected officials, and others that served on the working group came up with 3 scenarios driven by a definition of those scenarios with respect to a minimum to a significant spread of the virus in our community. So scenario number 1, where we have very small number of cases, we have very good percent positive, lots of testing. Scenario number 2, which is where we are today, yellow category, with kind of moderate spread. Going back to the charts that we just looked at, you can correlate these charts, the charts we looked at, with these scenarios and these colors, with moderate spread and positivities each day, and on the criteria, we'll show you exactly what those numbers are in the next slide. And then in the red category, which would be for all remote learning, kinds of conditions we saw back in the spring. So let's look at the criteria. Here it is, scenario number 1, which is the green scenario. Average daily hospitalizations, less than 10. We'll show you where we are today and where we've been. New cases per 100,000, less than 10 per 100,000. That's a very hard standard to meet. Dr. Hong, as we'll talk about, we're clearly in the 10 to 100 band right now, and then percent positives at less than 3%. You've heard me talk a lot about being at under 5%. So this is our stretch goal for scenario 1, which is minimum spread. And the idea here is that you meet 2 or more of these criteria, and it puts you in one or the other of the scenarios. If you're in the criteria is 1 of each, then the tiebreaker is scenario number 2. So scenario number 2, where we are now and have been for some time, it's 10 to 25 new daily hospitalizations. Dr. Hong will talk about this. 10 to 100 new positive cases, and a percent positive of 3 to 10%. You've heard me talk about 5%, which is where we're hovering around. And then to be in red, hospitalizations that are daily above 25, new cases above 100, new positive persons testing positive, again, above 10%. And so let's look at where we were historically. So early on in April and May, you might not be able to see those dates, but the dates take you from April 18th to May the 22nd, and most of those blocks are red by the criteria that public health has recommended for these different scenarios. And then from about the end of May until the end of the middle of June, which would have correlated exactly with our reopening, we're solidly kind of betwixt in between in the yellow category. And then hospitalizations starting in mid-June start to improve, and they're in the green category, but new cases are still solidly in red or yellow. Percent positive have one interval where they dip below 3%. And so again, today and over the last really month and a half, we've been solidly in the yellow criteria. We will make a determination based on these criteria a week from now. So we're getting a little bit closer to the opening of schools to evaluate whether we're recommending reopening in red, yellow, or green. Clearly, all the data suggests that we are in yellow right now. We've been in yellow for some time, and if I had to predict, we'd be in yellow a week from now, but we will make that judgment then. I know that in our interaction, we're having considerable interaction with school districts and school personnel. They are focusing on opening in each of those scenarios, but really leaning into the scenario number 2, the hybrid of some remote learning and some in-person instruction. My own view is that, and recommendation through the Department of Education, is that we really lean into the elementary school children as we look to bring children back to some in-person instruction. And all the information that we have from the school districts is that they're doing that. We will set this criteria. We will provide the guidance through Jamie Mack and his team, and each district has been assigned a public health professional to work through some of the operational logistics, and there are challenges there to see how they can meet the necessary requirements to reopen. The districts themselves will make that final decision. So help us get to green. Wear a mask in public, keep your 6-foot social distancing, wash and sanitize your hands often coming and going from retail establishments, and stay at home, particularly if you're sick. Most people, I think, are following that. Most people are following all of these, and increasingly I see more people wearing masks. And I would just ask everybody else to put a mask on when you're in public, and you're going to help the cause. You're going to help children go back to school. You're going to help our businesses reopen, and you're going to help everybody stay safe. And get tested. That's another important thing. Know whether your COVID-19 status. We have a testing site coming to a neighborhood near you, a school, a motor vehicle parking lot, a worship community, a church, a worship community. Know your status. Help us to get to green. So with that, I think that's up for me. I'm going to turn it over to Dr. Rick Hong. He's fondly referred to as one of the Dr. Ricks. We have two Dr. Ricks, Dr. Rick Hong and Dr. Rick Pescator, who are leading our public health efforts from the technical side, and I'm going to turn it over to him to talk a little bit more in depth about our gating criteria and other issues as it relates to the specifics of scenarios that we might encounter as we reopen schools in a safe and healthy way. Dr. Rick?
Great. Thank you very much, Governor. So during my presentation, I'll be focused more in detail regarding the school criteria and then review some frequently asked questions that we have received as schools plan to reopen. So talking about the metrics, we decided upon 3 metrics, and I want to explain further why we did not decide to use just one. We feel one metric does not really paint an accurate picture of what's going on in this state. So the 3 metrics, as reviewed already by the Governor, we are talking about the rate of positive cases, which is associated with the total volume of positive cases that we're seeing. We also wanted a metric that kind of shows the severity or the acuity of the cases that we are seeing. So the hospitalization rate does help give us an idea of the illness severity that's going on. And finally, using the percent of persons testing positive, and again, that's the number of positive results over the total number of tests performed. That gives an idea how we're doing with testing capacity. So already reviewed by the Governor how we're doing with all 3. You know, hospitalizations, we're doing fairly well, starting in the red, going to yellow, and maintaining green for a couple of weeks now. And then with volume and testing capacity, we're in a solid yellow. Again, just a reminder what our categories are for our planning scenarios for school reopening. We have the green, the yellow, and the red. But again, this is hopefully serves to be a guide for schools to make the best determination what the best route is for their individual situations. We do understand that each school is different. There are different planning efforts going on. There are different operational challenges as well too. So we are providing this guidance to them so they can make that decision. Hopefully the criteria listed are outlined in an easy-to-see format, and also allows for flexibility as well as transparency. We want to make sure everyone understands how we are coming up with our recommendations, and again, using the 3 metrics that we described already. There will be a document, frequently asked questions document for school administrators. I will go over a couple major points. The most important point I would like to mention is that we all should approach this as if we are going to get a positive case in schools. I think given the situation right now, for us to assume that no school will have any cases is not necessarily a realistic approach. We want to make sure we are planning appropriately and our response is effective as well too. So I do urge that all schools look at this in a scenario that you probably will get a case, a positive case in your schools, whether it's a staff member, faculty, or students, and this will give you the best planning and response opportunities. One of our recommendations in this document is to have a point of contact for schools regarding COVID-19. Now, already there's a process in place to address any infectious disease that may occur and threaten a school, and our epidemiologist within the Division of Public Health works closely with the school nurses to perform case investigation, contact tracing, and then develop recommendations for the schools. So that process is already in place. However, if a school determines they would like a COVID coordinator to focus on communications, to focus on administrative responsibilities or operational responsibilities beyond the medical piece, they can do so. However, we hope to maintain that relationship with the schools that we have right now regarding infectious disease control within the schools. And then finally, this document will hopefully provide answers on many of the how questions, and we're going to go through some of the questions in this presentation. So a common question that we got, what happens when a staff or student tests positive? So there are many ways that we will identify positive cases. Once a case is identified and there's a school link, that will trigger a priority response by our Division of Public Health, and we will work closely with the school to investigate that case. However, not all cases come to us first. Sometimes cases will be discovered through the school first. For instance, a parent self-identifies and self-reports that his or her child is a positive, or a staff member reports directly to the school. So it's important that we have that two-way communication and still continue that relationship we have with the schools so that we can have an effective response. On DPH side, the public health side, we may be notified through a positive lab result. We may be notified through a call or an email. And again, once we receive that information, we will share that with the school, and again, for an effective response. We'll work closely with the schools to assist with identifying close contacts, and then from there, we will develop recommendations based on what we learn through our case investigation. And again, to mention, we need your help, as in the parents, so please be encouraged to notify school if you have any concerns or specifically if you know of any positive cases.
And Dr. Hahn, this is consistent with our existing practice with respect to infectious diseases.
Absolutely. Infectious diseases can occur in the school setting, and they know how to contact Division of Public Health, how to work with our epidemiologists to be able to address any infectious disease. So the routine process is already in place. We may have to strengthen that process, and again, we want to work with the schools on that process. Another question we got, will the school need to be shut down? So there's an instinct out there that if there's a positive case, the entire school needs to close down. And that is very unlikely as long as infection control measures are being followed, which means appropriate use of face coverings, hand hygiene, and social distancing. So unfortunately, there is not a one-size-fits-all answer, so we really need to work closely with the schools to get the pertinent information to be able to provide the best recommendations for each individual scenario. So the risk assessment, as well as the guidance provided, will be based on the case investigation itself. And as you see with the scenarios we're going to go over, that adherence to use of face coverings and social distancing will be vital. And if compliance is there, there's a less likelihood that anyone would need to be quarantined and that a school or a certain classroom will have to be closed down. So going through our first scenario, for instance, you have a teacher that tests positive but has consistently worn a mask or face covering and was not closer than 6 feet to anyone for more than 15 consecutive minutes to any of his or her students. If that's the information received, then we would not recommend any student to be quarantined because social distancing as well as the use of face covering was followed and again did not meet the criteria of the 6 feet distance. So in that situation, there will be no need for quarantine of any student in that classroom. Going to another scenario, you have a first grade student that tests positive, was sitting at a desk fewer than 6 feet apart from another student for more than 15 minutes and did not wear a mask. Since infection control measures were not followed, did not wear a mask, and was within 6 feet distance for more than 15 minutes, we would recommend that the adjacent student should be quarantined. However, if we put in the caveat that a face covering was used, it does significantly decrease the risk of transmissions. So as a result, if face covering was used consistently, even though that child was within 6 feet from another child, the student next to the positive case would not need to quarantine. And this has been recommended through various institutions and organizations such as the American Academy of Pediatrics, as well as the World Health Organization, as well as the CDC. So just want to make a comment about face coverings. You know, one of the complaints that we receive a lot, and Jamie and Mack will go further into detail, people are not using face coverings correctly. So just to remind folks, if you're going to have a face covering, for it to work, it's got to be used appropriately. So the face covering must cover your nose as well as your mouth. We have seen a couple times where it covers just the mouth, maybe it doesn't cover the mouth or the nose, it's around the chin. Really, if you're going to use a face covering for the purposes of infection control, it needs to be covering your nose and mouth. However, as we all know, there are medical exemptions, and the medical exemptions are there because there are populations that would be harmed using the face covering or the mask. Again, if you can wear a mask or face covering, we highly recommend you do so. And for those that truly cannot wear a face covering, consider your risk assessment going out in the public without the face covering. You may be able to, quote unquote, not use a face covering, but your risk may be significantly increased for not only getting disease, but getting complications, as many of the medical exemptions are on the same list as those that are higher chance for complications for the disease. So again, a medical exemption does not give you a get out jail free card. They can go around without a face covering. You may be endangering your own life or others as well too by not wearing the face covering. So please consider, if you have a medical exemption, what are your additional risks going out in public without that face covering. And finally, as the governor mentioned, you should know your COVID-19 status. We are recommending testing for anyone who's interested. As you recall, initially during this pandemic, testing supplies were limited, so as a result, there was a prioritization for those that needed to get tested, and that was focused on those at higher risk and those with symptoms. We are fortunate enough in this state to have the testing capacity to really offer testing to those that want to get tested. So it is important for you to know what your status is, especially if you had an increased risk of exposure recently. Make sure you know what your status is, so you need to know what else that needs to be done beyond the normal infection control measures. Also, as a reminder, if you get a negative result, that does not mean that you can forego all those infection control measures that I already mentioned. A negative test just simply means you are negative at that point in time. You can become positive at any moment, so you need to still continue your infection control measures, which includes social distancing, which includes use of face coverings, and includes hand hygiene. Thank you.
So thank you very much, Dr. Hahn. Great presentation. We appreciate the tremendous work that you're doing for the people of our state and the guidance that you're providing for all of us. I'd like to go to back to those two last things there. First, know your COVID-19 status, get tested, and wear a face covering. I mean, these are the two of the most important things that we can do to enable our children to go back to school and to enable businesses to open more freely. And when you think about going back to school, we have testing sites. In fact, there's one, I believe it's today, in Laurel, and the school district down there has been doing a really good job in thinking through how to bring students back in a mix of remote learning and in-person instruction. But having people go and get tested prior to that also gives us an idea of the health of that specific community. As I've said last week, we'd like to test all the educators as they go back to school initially and then periodically during the course of the year, and we will make that our goal as district decide exactly how they're going to do that, so we have to know who we have to test and when. But I would encourage people that live in those communities, in the various school district communities, to get tested so they will have a sense on our My Healthy Community site on the website, which you can break down by zip code, by county, by town, by representative district, by Senate district, and you can see the numbers in your individual district. So let's wear face masks and let's know our COVID-19 status. Let's get tested. So Jamie Mack has done an incredible job working with businesses across our state and events, trying to help folks do their business, come back online, and do it in a safe way that protects the rest of us. Jamie?
Thank you, Governor. Yeah, my group within public health has been working with businesses and people throughout the state for a couple months now. And in the beginning of July, we consolidated complaints and enforcement under DPH. And since then, we've had just about 1,000 complaints come in. Once a complaint comes into our office, it is sent out to the appropriate county environmental health office. And they'll either hold that complaint, gather more information. If it's a simple issue, they may make a phone call, or if it's a more significant concern, we'll go out and do a site visit. And we've done just over 300 compliance checks in July. And we recognize that a lot of businesses and a lot of people are doing the right things. But as the governor and Dr. Hong have said, and as the numbers have shown, we want to do a little bit better. So coming into August, we're looking at how we can increase our enforcement presence, as well as, maybe raise the bar a little bit, maybe see if some of our businesses and those in our community can do a little bit better. And as part of that, we're talking about some revisions to the executive order related to face coverings. No significant changes, more clarifications so that we can ensure that everything is clear, the expectations are clear, and that the folks on my team that are going out doing enforcement visits have clarity on, what they're looking at, what they're seeing, and we can ensure that, people aren't taking advantage of any loopholes that may exist or, be able to be found in the existing language.
So the idea here, if I could just jump in, Jamie, is to try to achieve our objectives of flattening that curve through a little tighter enforcement. Enforcement to date has been mostly educational, helping people work through it, but we need to get, the other approach is to go backwards and limit the ability of businesses to be open in some form or fashion. We'd prefer not to do that. So we're going to try enforcement, targeted enforcement first. And so folks need to think about the conditions in their establishments so that we can really make the progress that we need to right now. And Jamie's team will do a great job in making that happen.
Yeah, so it's almost counterintuitive to think that we're increasing enforcement to keep businesses open, but that's really the case. We want to make sure that we have adequate protections out there for the public, but we also want to make sure that the businesses are taking the right steps, and that we're able to hold the ones that aren't taking those steps accountable so that we can ensure that businesses doing the right thing, can remain open. Now, looking at this slide, we see some of the basic things that we look at when we go out and do what we've termed a COVID compliance check. You'll see that the face covering violations, that's right at the top, and that is partly because, as the governor and Dr. Hong said, that is one of our most important protections, but it's probably also the most common complaint that we get right now. And that just shows that that's where our enforcement needs to focus a little bit more, and that's why we're working so hard on, some of our next steps. We also look at social distancing. In the case of a restaurant, we want to make sure that their tables are adequately spaced. We want to make sure they have a reservation system or some other system to prevent people from gathering as they wait for tables or service. If a businesses have everybody socially distanced inside, it loses its value if everybody is clustered at the door outside. A lot of our businesses are operating at limited capacity, and we're keeping an eye on that to make sure that nobody's pushing that envelope too far. We do have the authority, if needed, to bring a business back to phase 1 restrictions or even further if necessary. Then PPE, hand washing, hand sanitizing, that along with the social distancing and our face coverings is one of the main protections that we have in place, so we always keep an eye on that to make sure that adequate supplies are available, make sure staff have adequate time to wash their hands, sanitize hands between customers, make sure everyone is taking those protective steps. And then we also look for floor markings, counter signs, door signs. We just want to make sure that it's obvious the facility is taking this seriously and they're doing everything they need to inform the patrons coming in. So when we do go out and do compliance checks, as I said, our goal is to allow businesses to remain open. So our first step is almost always an education and information visit. We want to make sure they have the right information. If they have some challenges in their specific facility, we help provide some recommendations, how they can meet the compliance standards, how they can better protect themselves, their customers. If we have to go out a second time, third time, that's when we have a very different conversation than that educational conversation. And thankfully, at this point, once we start putting some dollar signs on inspection forms, masks tend to appear very quickly along all the employees and folks in an establishment. So we haven't had to get too aggressive yet, but we do have fines, closures, and reduced capacities as tools we can use to reinforce the importance of what we need to do. And then obviously, if we walk into a place and we see significant concerns, we see a place that is simply not taking this seriously, my folks, they'll often expect changes before they leave, or they have nice bright orange closed signs that they can put on doors of businesses that refuse to gain compliance, and then we can take some additional steps beyond that. So with all this talk of the closures and restrictions, we always think it's important to share some positive news. And I mentioned earlier that we've done about 300 compliance checks, and we have had 100 of those sites that were in full compliance when we went in and looked at the establishments. And I do tend to talk about restaurants a lot because food safety is one of my core programs, but the division is inspecting across all business sectors now. We have been to restaurants, we have been to gyms, we have been to salons, we have been to hotels, we have been to office buildings and any other variety of business you can think of. And then my inspectors recently provided me a couple of names of places that have been visited recently and were doing a good job. So we like to recognize places like Lucky's and Buckley's Tavern and Restaurant 55 in Dover as taking, being very protective of both their employees and their customers. And then the main way that we find out that something is not going well in the community right now is through complaints. And this email address, hspcontact@delaware.gov, is the primary means where we receive complaints. So we just want to encourage everyone that if they see a business that's not in compliance, if they have a concern, even if they have a question, they're more than welcome to reach out to that email address. We have folks monitoring that box. They get triaged out to the counties, and we respond as quickly as we can to every complaint that we get.
So as Jamie Mack mentioned, our objective is not to close down businesses. Actually, it's to open them up and to allow them to stay open and stay open safely. And we can do that by improving the conditions on the ground, all of us, by being smart, by getting tested, washing your hands. Most importantly, wear a face mask, face covering, particularly when you're supposed to outdoors and in retail establishments, hospitality, businesses, bars and restaurants. The bar areas are not open. The bars themselves are open for table service, but it's these indoor environments. We have allowed establishments to open more space out of doors, and that's been very helpful for many restaurants and bars with table service. And so we would encourage you to help by wearing a face mask and practice social distancing and help us enable children to go back to school for in-person instruction. And so with that, I want to thank again folks for coming and tuning in. We do have questions that were submitted in advance. We also have Meredith here from the News Journal. We welcome her as usual.
Hello. Governor, I wanted to ask, considering the criteria released today, as well as the Democratic Party and the teachers union supporting a virtual start, why not just announce a hybrid model today opposed to waiting a week? What's the hesitation?
Yeah, so it's really the data changes on a week-to-week basis. We saw that, and I wanted to emphasize all the graphs that show the infection rate go up, peaking, and changing really week to week, following the guidance of the CDC. 14 days, more than 14 days of improving conditions, which we saw before going into phase 1. We did, if you think back in the spring, kept schools open until we felt like, of course, we didn't know as much then, that we needed to close the schools, and tried to be thoughtful and follow the science and the recommendations all the way along. So the closer we get, so it's a balance, right? You need to give the school districts time to work out the logistics so they know where they're going to be, and you want to make the health data as current as possible. And I think one of the main messages is we've been in this kind of interim period for some weeks now, not as good as we want to be, and not as bad as some of the other states that are really in bad shape. And so that's what's put us on the quarantine list with states around us, unfairly, I might add. But also, we can control that, again, by really leaning into everything we've talked about today with respect to protective measures. I would guess, I'm not a scientist, but I would guess if we improve by another, I don't know, 25% or better, we could move that number down further in terms of mask wearing. And so it's just a level of awareness for all of us as we get complacent and don't think about it, think it's not going to affect me. Well, it has, and just the whole, if anybody who's a big baseball fan as I am, and saw what happened to the Florida Marlins, I mean, just like that, they got 15 guys positive with all the money and protections that you would expect. My guess it was complacency and not following those, and certainly not the conditions on the field, because they, you would think, followed those. So we want the data to be as current as possible, but giving districts enough time to react thoughtfully. So it's a balance that needs to be struck.
And in terms of oversight and enforcement, will the state be going into schools to making sure that teachers, staff are following the protocols that you all have put out and the CDC guidelines?
Well, I can certainly see the liaisons that we've assigned, and I'll let Jamie respond to this, because he's been doing that with business establishments, I assume. They've got these liaisons, and my guess is that they want to be on site at one time or another to see how they're doing. And we just got a call, and the mayor's call that I had earlier today, one of the mayors actually happens to be operationally involved in one of the school districts and had questions just about the logistics of plastic shields. Jamie, you have any response to that?
Yeah, I would say, the relationship with the school districts on, whether COVID or day-to-day basis for food safety, it doesn't tend to be as much enforcement as cooperative. I think they're more likely to call us, ask us questions, ask us to come in and provide some advice, provide clarity on questions. Whether it's air quality, food safety, or COVID, we've done presentations to teachers, to school boards. We have a very good relationship with a lot of the school districts, and we just expect that to continue as we work through these challenges.
I ask because just to use nursing homes as an example, despite, sometimes best efforts, they still weren't following CDC guidelines due to a variety of reasons. And that was shown through federal inspections, which were, of course, done by the state. I'm just curious, with schools that are taking on a lot, and especially people taking on health issues that aren't healthcare experts or providers, I guess what oversight. So there's no plan right now in terms of oversight with the state?
Well, no, I wouldn't say that, because there's always the complaint process.
Okay.
If we were to get a complaint about a school district, a school, we're certainly not going to just pass that to the school district or let that go. We'll follow up on that like we would any other complaint. But generally, when we go out and do that, we have open access to the schools. We're able to sit down with them, make recommendations, and just work together to find a quick and easy solution.
And with due respect, it's not really a comparable situation. The schools are us. The state and the districts run the schools. We've been working with them from the springtime and the closer. I've had conference calls with the superintendents on almost weekly basis. I have a staff member who's an education advisor who's been working with a working group about all of these issues, both on the education and the public health side of it. We have specific members of the public health team assigned to each of the individual districts, and we've got resources that have been made available by the federal government CARES Act about $50 million total, most of which is going to the districts. So it's a very different situation. We're way ahead of it as well. They're currently not open. There were a couple of districts that had some summer school. So I understand the point of your question, but they're very different. It's a very different relationship.
And I quickly just wanted to ask if there was any more information regarding Destiny Christian Church in Dover, and if there's any indication that there could be a possible outbreak just due to the conferences and the hundreds of people.
Yeah, I think Jamie did and his team did that investigation, and I think he has some information.
Yeah, so as soon as we became aware of the conference that they held the last couple of weekends, we reached out. I specifically and personally talked to the church leadership. They've been very receptive to the steps we put in place, both on kind of restricting activities until we complete some of the EPI investigations. I believe there was a testing event conducted there today that actually went above and beyond in terms of the number of people that were tested. I think we were expecting about 100, and we got significantly more than that. So we were able to review some Facebook Live video, saw some of the services, and we talked to the church leadership. They recognized they had some challenges with the face coverings, with social distancing. So we're going to continue to work with them to make sure they have a plan in place before they're able to resume full services. In terms of whether it would be an outbreak, I think it's probably a little too early to make any type of determination.
And it needs to be said that churches are different. They're special. They're places of worship guaranteed by the First Amendment. And so Jamie indicated a very good response when he made the contact. We did test, the report today was 300 people were tested today there associated with the church, some that weren't just part of the church gathering. And so, but on the question of whether there's an outbreak, I think we'll have some sense of that once we get the test results back, which will be a couple days probably. Thanks, Meredith.
From Johnny Braxton at 6ABC, on senior centers opening, what was taken into consideration in making that decision, since seniors are the most vulnerable group?
Yeah, so obviously seniors are the most vulnerable group, and one that we're very concerned about. They also get fed at senior centers. They get socialization that's really important for their mental health. I think about my mother's own needs for social interaction with her children and others. But in senior centers, I think we can do it in a safe way. I'll have Jamie talk about that. We are very conscious of the risk there, but there are important things objectives that we're trying to accomplish there as well, for the overall welfare of those seniors.
Yeah, so Public Health was able to work with one of our sister agencies at DHSS to develop plans for a couple of different types of senior centers, and they've been communicated out to the centers. They've been part of the process as well. We have the plans address things like social distancing, the face coverings, and kind of lay out the minimum standards for these places to operate safely.
And they're limited to 30% capacity.
Yes.
So
Yeah,
significant limitation on their capacity.
From Lauren Romero at ABC News, are there any reports of shortages of remdesivir in the state? Has any been allocated from the federal government? If so, how much and when? Is it enough?
Yeah, I think Dr. Hong can address that.
Sure. So remdesivir is one of the drugs that have been approved by the FDA through the EUA process to treat COVID-19. We've been involved with the federal government regarding the allocation process. It's been at least a month or so, and we do continue to still have a supply of remdesivir. Hospitals have not expressed additional need at this time. We have heard that other states are in a shortage, and actually the federal government had reached out to us whether we wanted to reallocate some of our deliveries to them. Since we are supplied well, we offered whatever we can do to help other states.
So Dr. Hong, it came up the question was raised on our mayor's call this morning about remdesivir and how it was being used by the healthcare provider providers. Is it used in the hospitals? This question was, should it be used as a preventive measure for keeping people out of the hospitals?
So it's a good question. So remdesivir is used for treatment, not for prevention. The EUA specifies criteria for its use, which includes hospitalization and oxygen requirement, and also some additional laboratory results to make sure people will benefit from the medication, as there are side effects to the medication.
From Nick Cialino at Delaware Public Media, researchers out of the policy lab at CHOP are forecasting a possible rebound of the outbreak in our region, and they name Rehoboth as an area of possible concern and say the virus is essentially traveling up corridors like I-95. Would you consider a travel advisory on Florida, the Carolinas, or even Maryland?
Yeah, so it's that research. Actually, Governor Tom Wolf mentioned it when I talked to him last week, or more than a week ago, I guess, about Pennsylvania's quarantine on Delawareans, and the concern I know that he has in Pennsylvania. Governor Murphy, Governor Cuomo have, Governor Lamont, Connecticut, New York, and New Jersey, about it spreading from the southeastern states. They have a much more travel in and out of Florida and some of the southeastern states into major airports in Philadelphia and New York and North Jersey, and so their concerns are greater than that. We've already seen in our region how dysfunctional it can be, particularly with respect to states like Delaware that are really on the margin from one day to the next or 1 week to the next. So we would certainly consider it, as we did in the spring, if there was an identified risk associated with travel from either people, states in the region, or from outside of our state. We do not have an airport with a lot of that travel coming in and out. We do obviously have the Northeast Corridor and Amtrak. There's currently, we've not seen in any of our data or any of our information from interviews and contact tracers about the risk associated with that travel. It's still an option, obviously, but not one we're looking at the moment.
And this is the final question from Amy Cherry at WDEL. Are you concerned about further economic pain for the Delaware Beach community given DC's quarantine order?
Yeah, I really am. You know, the interesting dynamic, and it's kind of part of my message today, is that the beach establishments, bars and restaurants, hospitality industry have been negatively affected by the quarantines in other states, and the Baltimore-Washington corridor sends a lot of visitors to our beaches, some of whom who live in the district will face this quarantine if they travel to Delaware, and it's going to negatively impact our businesses there. We're in that situation in part because of non-compliance in hospitality establishments at the beaches and in congregate living communities there among that young adult population. And so we can fix the problem ourselves by really leaning into protective measures, by leaning into our responsibility to protect ourselves one from another in congregate living spaces, to drive our numbers down, and then we'll be off that list and we'll be able to move on in terms of phases, and people will be able to reopen more. But we know, and the evidence is clear, a correlation between the increase in cases that we've had with that young adult population in hospitality establishments at the beach communities that have driven us to the quarantine status in the first place. Let's unravel that and let's drive those case numbers down by getting tested, particularly healthy people, by the way, and by being protective in those establishments and in our living spaces, and particularly among that demographic 18 to 34-year-olds, and then we could fix the problem ourselves. That's an incredibly important part of Delaware's economy, the tourism economy in our beach communities during the summer months. And I've been saying for some time that we need to balance off the health of the community and the strength of the economy. You got to have both. And so you can't just have one and forget about the other. You can't just open bars and restaurants and ignore the health because it affects it. It came to our attention because employees in various of those establishments tested positive for COVID-19. So let's fix that by leaning into these protective measures. We're going to do our part by increasing the enforcement, and so that the establishments that are following the rules and really putting an effort are not negatively impacted by those that aren't, and that we'll have greater attention and awareness about the responsibility that we all have. So with that, let me thank those for tuning in today. I want to, in particular, thank Dr. Rick Hong, who's one of the famous Dr. Rick's pair at the Division of Public Health as our medical director, and really doing an incredible job in a difficult time, and Jamie Mack, who's a star as he goes out there and tries to flatten that curve and enable businesses to stay open, and being sensitive to those two very important objectives. They both have very difficult jobs, and they're doing an incredible job for the people of our state. Thank you all for joining. We'll see you next week.